Hello again, and welcome to Forum for a Better Understanding. You know, last week on our program, Lázaro Salazar said we can't do immigration reform without having something very cleared up first, and that would be healthcare reform. They're connected, and it's very important we deal with both issues. So I'm very glad that this week we're able to come back to our third discussion together on the forum around this topic of healthcare reform. You may remember a couple of weeks ago we had a panel and we talked about the myths and some of the tremendous fallacies, I would just call them lies, about healthcare reform that the media is reporting. And then we also had some ideas about the local situation and the need for reform here in the Valley itself, particularly. Now today we have two guests who are going to talk to us about personal convictions and also some very, very reasonable solutions that weren't proposed in the other two programs. We're going to talk about specific bills and specific policies, practices, and coverage that some of these guests are receiving as we speak. Now my first guest is Elfie Ballis. Now we have used Elfie before on our show, but usually behind the scenes, and we've aired some of his wonderful docu-poems. Elfie is the founder of Sun Mountain Productions, and we have wonderful material for the last 50 years of social justice activism that Elfie has been chronicling. He's a very, very strong advocate of all the work of Cesar Chavez, knew him personally, followed him and worked with him, and has chronicled for us all the people who have followed in Cesar's footsteps. To his side is Bill Simon, a very good friend who happens to be a fellow parishioner at the Newman Center, where Bill is also the strong, active member of the Peace and Justice Project ministry at our parish. He's also a past president of Peace Fresno and has been involved in social justice issues from a Catholic perspective for all of his adult life. We're really glad that we have such veterans in this field, but let's begin by telling people what we haven't told them yet, Elfie and Bill. Anything about yourself and about how this burning commitment towards social justice is something you are personally so committed to all your life. Why?
Well, I had to learn that when I looked into a mirror, I saw everybody else. That's the trick. Not them and us, but us.
And that changed everything.
That changed everything.
Bill, about yourself, what is it that makes you so committed to social justice in so many different aspects, so many different varied commitments that you've kept up? Why?
I think it basically has to come down to my Catholic background and the strong social teaching. When I was in my 20s, I was involved in Skid Row in Chicago, involved a little bit in healthcare then through Mercy Hospital. But then I spent 25 years raising a family and doing Boy Scouts and band boosters. And then when they didn't need me anymore to do that stuff, the Iraq War was starting, which was so clearly unjust. I got involved again and then into Peace Fresno. And that leads you into all kinds of social justice questions. And that leads into civil liberties questions, so we got into the American Civil Liberties Union, and you have to do it all in the context of your church, which brings us to St. Paul Newman Center, so it keeps me busy.
It keeps you full-time employed, definitely. Now, one question to begin before we see Bishop, who's going to be our third panelist, is Bishop Steinbach, about healthcare reform. Elfie, your personal reason, an opening statement about why healthcare at this point is so prominent in your thinking and in your work.
Well, I'm here breathing, alive, smiling, because I'm alive because of the single-payer socialized medicine we have here in the United States, namely the Veterans Administration. They have saved my life and saved my money.
And you want to talk about that this day.
Yeah.
That's our whole topic today. In case you didn't know, single payer is our topic of preference today. Of course, there's other bills we're going to look at as alternatives, but we're going to go with the single payer, definitely. Bill, your own personal feelings that make you want to be on this panel today about health care?
I think what makes me angry is that I shouldn't have any personal concerns about health care. I worked for a large company for 27 years, had excellent benefits, and granted, over the years, I had to pay more and more of the percent of my health care, but it was there. But now that I'm retired and my kids are grown, they can't get health insurance that's affordable. 2 of them don't have it at all. So there's that family thing. But then I look at the debate that's going on and all this yelling about a death panel, and that reminds me, I mentioned I worked at Mercy Hospital in Chicago. That was 1967, 68 for a year, which was the time Elizabeth Kubler-Ross came out with her book on death and dying. Met her a couple times, and one of her themes was that doctors are so dedicated to preserving people's lives that they can't admit to themselves or their patient that they're dying. And families are so upset that they can't admit. So you have dying people laying in bed, unable to talk about this important part of their life. And H.R. 3200 says, you have to talk about it. I said, wow, Elizabeth Kubler-Ross is finally going to become the law. The second thing is that my older sister has a housemate who has, I think they call it cutaneous T-cell lymphoma, which is a very rare cancer of the white blood cells. Now, she was a nurse during Vietnam, so she could also have government health care, except to get there it's 2 hours away, and she just doesn't feel that well, so she depends on her personal insurance, which won't approve a liver biopsy. It won't approve even a colonoscopy, so her doctor can't find out what he needs to do to treat her.
Oh, gee.
The third thing is that I'm on Medicare now. I finally have to admit to having grown up. And when my children were small, I got mad at the insurance company because I had to argue with them every time we took the kids to the doctor. So I changed to an HMO, which has served me well. But now that I'm on Medicare, this HMO is what we call Medicare Advantage, which is privatized Medicare. The government doesn't run it. They pay the HMO to do it. So I am completely at the mercy of my HMO for my medical care. And they've taken good care of me. But my daughter, who's an occupational therapist, says, you better change. Because when you need a convalescent hospital or a rehabilitation hospital, they're only going to put you there for half the time you need.
Boy.
Then they'll send you home to die. Where's the death panels? It's with the current system. And so that's why I'm personally interested.
Well, you are personally and familiarly so impacted by this with the very people, so many parts of your life. What we're going to do now is see one more person on our table. Bishop Steinbach is going to share his pastoral message, that is this month's message on comprehensive health care reform. Let's see what Bishop has to say for us on this very important issue.
The following is a pastoral message from Bishop John T. Steinbach, Bishop of the Diocese of Fresno.
My dear people of God, I've been asked on a number of occasions, where does the church stand on comprehensive health care reform? The church does not involve itself with the specifics of legislation. This is the work of Congress. There will always be dissension over the specifics of legislation, but the church does present principles to guide in the formation of this legislation. The bishops of the United States have long been advocates for comprehensive health care reform. It is the clear teaching of the church that everyone has a human right to basic health care if there is to be true respect for the dignity of the human person. But there can be a lot of different ideas as to what basic health care means. The church has long been one of the main providers of health care here in the United States. Few people are aware that 1 out of 6 patients is cared for in Catholic hospitals here in the United States. And most of these hospitals are involved very much with the care of the poor and indigent. Here are 3 main principles that the bishops of the United States say must be included in legislation regarding comprehensive health care. 1, the policy must respect human life and the dignity of every individual from the moment of conception to natural death. The legislation should not extend the promotion of abortion nor promote euthanasia in any form whatsoever. 2. The legislation must respect the conscience rights of providers of health care, making sure that healthcare professionals and healthcare entities are not forced to participate in procedures and practices to which they have moral objections. 3. The legislation should cover as many as possible, especially the poor, the indigent, and legal immigrants in our nation. Sad to say, a number of bills in both the Senate and House have contained elements against these principles. If they were to be part of any legislation, it could be there could really be the end of Catholic health care as we now know it, and the end of the service of countless doctors and nurses already in such great demand. It is morally irresponsible we do not have comprehensive health care in our country when practically every other industrialized nation cares medically for its poor and indigent. But it would be a crime if our legislators pass any bill for comprehensive health care that promotes abortion or legislates that medical professionals must act against their conscience. It is not too late to contact your representatives in Congress. Do it now. God bless you all.
This has been a pastoral message from Bishop John T. Steinbach.
We have about a minute before our break that we self-imposed. I wonder if Bill and Elfie, either one or both, had any minor remark, reflection, observation about anything that Bishop shared regarding his own hopes for healthcare reform or his wariness over where it could possibly go.
As far as I'm concerned, the only healthcare reform that is workable and just is the single-payer system, which covers everybody now and doesn't have a bunch of triggers or doo-doo-doo-ba-ba-gags in it.
We'll come back to that in the second half of the show. Bill?
I was impressed with his statement that it's irresponsible that we do not have comprehensive health care like the rest of the world that cares for the poor and the indigent. I think it's really important that he got that into the statement.
We are going to be taking our little break that we always do at the middle of our program, and we'll be back, so please don't go anywhere so we can discuss with Elfie and Bill the favorite plans they have regarding legislation being considered in Congress as we speak.
KNXT thanks all its loyal viewers and respected businesses who have supported your Catholic television station. Now you can support KNXT with program underwriting by having your name, your company's name, or organization associated with your favorite program. Detailed information about you or your company will appear before and after each program or day part you select. Keep the quality and spiritual message alive and make a difference. Call 559-488-7440 today or go online at knxt.tv to find out more about program underwriting on KNXT.
Welcome back to the second half of our program on our favorite hopes for what healthcare reform would include. Elfie's going to be telling us a lot about something very personal that he is very, very happy with. I just want to remind everyone what Bishop said and why that is going to be for us on our station and as a church very important to keep in mind regarding all discussion on this issue. The idea of abortion and euthanasia, he makes it clear as a Catholic church, we are definitely opposed and looking for legislation that would not include, mandate, or force that issue. Secondly, he's making the point that at hospitals, we're going to have no mandates coming down that are making it impossible for these Catholic institutions, 642 hospitals that they are, to be mandated to perform operations and procedures which would be against Catholic teaching. And then Bill's point that is very important, echoing Bill, what Bishop said, the stress on the need for this comprehensive reform to be extended to all of us, especially those most indigent and most in need. So with that basic premise clear of where the church is teaching us on this issue, that leaves many, many options out there that would be respecting of those priorities. So single payer, introduce us to that and why that works for you so much. Tell us that concept so people will say, I wish I knew more about that. I'm more informed than I was. We don't know enough about single payer. Tell
Well,
us.
first of all, I'd like to go back to the bishop's statement. I think what he said is, and the way you interpreted it at least, is that the Catholic hospitals not be forced to do, mandated to do this. I agree with that. Nobody should be mandated to do anything they think morally incorrect, even though it may not agree with everybody else. Right. Okay, the single-payer system. I fought World War II with a screwdriver. And as a result of doing that screwdriver in the Pacific Islands for 3 years, I have unlimited health care. All I have to do is go and show my card, and they take care of me. And I think that's the way health care should be. And people say that's going to cost a lot of money. Well, what's ruining this country financially and morally is war, not any projection on what health care is going to be.
Now, how many people, Elfie, you're not unique in this idea of having this wonderful coverage. As a veteran, you receive this coverage.
But everybody should get it, not just
Right,
me.
but I'm trying to see, how many people are benefiting at this point from the type of benefits that you have?
Well, I don't have any numbers in my mind.
Veterans, these are.
Yeah. You're right.
And only certain people have this Cadillac plan that you have.
Right.
And you are so sweet, you would like, and you see every reason everyone should.
Because I look in the mirror and I see everybody else, and they should get the same knife that I get.
Now, why
When it's necessary.
don't they?
Because we've been sold a bill of goods by insurance companies, and they have so much pressure, so much money involved. Their profits have gone up like, I don't know, like I think it's 400 or 500% in the last 6 years. And they have bought the Congress so far. And the only way that can be changed is if enough of us rise up and say, hell no, this won't go.
This will go. Bill, where are you with single payer as the only option, or are you more conciliatory to other possibilities, or is it all in one basket?
Single payer is the only real possibility. Can we get there gradually? Well, if we do, a lot of people are going to die. But you almost have to look at this historically. We came up with health insurance because at their peak of the power, the labor unions could tie it to employment. Your employer supplied your insurance. That worked. But in our global economy, it doesn't work anymore because Europe opted for a different system. They opted for national health care. And so now when our businesses try to compete globally, they can't because they're still saddled with payments for health care. So they're dropping it. They're making the employee pay more of it. Health care insurance becomes less available to people because we went with a different model. Truman told us in 1948 that we should go national health care. England did. And so they're ahead of the game. We just cannot afford health insurance anymore, especially because the profit motive has become so central to any business, and profits have become so huge, and administrative costs are so huge that our insurance costs us too much. When I talked about Medicare Advantage before, the point was that if you privatize it, it'll cost less. What's happened is a patient on Medicare Advantage costs the government more than a patient on regular Medicare. We have to go national health care, single payer.
What about, can you give any insights into the downsides of other options that are out there that are really pushed up in front of us? HR 3200, what comments would you want to make on that? That's a clear comment. Any detail? That was very clear. You don't like that very much.
HR 3200 is so long and so complicated that when I tried to download it, my computer told me don't because it'll freeze. It's that big and that bad. The only possible salvation from it is Dennis Kucinich's amendment that changed ERISA to say that states can have single payer, so that maybe over the next 40 years we'd get single payer just like they have in Canada, where it's a provincial system, not national. We could have a state system. but it would take so long that it wouldn't solve the problem very soon. So H.R. 3200 just doesn't fly.
The other interesting thing about that is people are arguing now, those illegal immigrants, those, well, that's us. But anyway, that argument aside, I could get on a plane right now, fly to France or England or go to Canada and get health care for no money at all. What are we doing here?
You know, the other part of that, though, is that I need them to have health care. I need you to have health care.
Yes.
You go to a restaurant to celebrate a birthday anniversary or just that it's Friday night, and what you have is people who don't get paid for sick time, they don't get health care, so they're there working sick.
And-
All these food servers and bussers and kitchen staff are there to make me sick.
That's why we should look in the mirror and see them.
If they have health care, I can eat better. If you guys don't have health care, I'm going to catch whatever you've got and have to buy a box of Kleenex and a bottle of NyQuil on my way home. I need you to have health care.
Now, is there any way that this reasonable alternative of looking at the rest of the world, that it's ever going to be that we'll ever get to that point in this country of doing this?
It's sort of a religious problem. It's at least an ethical problem. And the mirror is what works. If I look in the mirror and I see those people in Indonesia working for $1 a day, and they're producing food that I'm supposed to eat, and I understand that, I see them as me, that's what's going to change us.
And we just don't like to do that.
I know,
We really don't like doing that.
I know, but we have to do it because that is the truth.
Yep.
That is the religious, ethical, moral truth.
Now, one thing that you filmed about a month ago gives us some insight into an effort in town to have a rally around this issue.
Right.
Let's roll that clip that Elfie created for
us. We care for you.
We care for you.
We pray for you.
We pray for you.
You are our brothers and sisters.
You are our brothers and sisters.
Under our current broken system, we have allowed profit, and we have allowed greed, and we have allowed economic status to define who lives and who dies.
You know, my autistic brother, he's had enough of this fear too. He's had enough of being turned away from insurance companies because of his pre-existing conditions. My mother has had enough. She pays half her income, she's on Social Security, she pays half her income to pay for the medications that she and my brother need because liver cancer is a pre-existing condition. And insurance companies don't cover that. Let's see. I'm sorry. This is like hard, you know. We're out here today fighting for our brothers and our sisters. We're out here today fighting for our families. All we're asking for is health care with a strong public option that covers Americans that can't afford this. But we have people that concentrate on fear, they concentrate on the negativity, and they divide us as a country. And we need to stop that, and we need to say loudly, louder than they can say it.
That's right.
We are not going to take this anymore. We're not going to take the fear. We were not going to be afraid.
All we are saying, give free for much.
I became a high risk of having a heart disease or probably some form of cancer. My health care provider scheduled one test. I was on the Healthy Common Insurance, I won't say the name of the city. So they took one test, but it showed a dark spot on the right side of my heart. There were 2 more tests that had to need to be taken to stop the arteries from blocking up. I was in the hospital for no more than 3 days, and when I returned home, I received a letter that was in the mail telling me, thank you for your services. You owe us now $10,000. I could not believe it until this day. I'm still fighting, trying to pay it, but the common health insurance only paid $3,000 of the bill.
Health care now! Health care now!
We all need each other. We are all interconnected and need each other. And when one of us is ill, that person needs us, and we need that person to teach us what our humanity is. And together we build a deeper kind of humanity. So I'm here just as a representative of my congregation to say that as the Unitarian Universalist congregation of Fresno, we support health care for all with a public option that will care for everyone.
We need people with moral fortitude to have your voices heard. I want each and every one of you to make sure that you call. You call every day. You call every day until Representative Costa and Dianne Feinstein and the Congress pass affordable, quality, accessible health care for all.
People over profit, health reform now. People over profit, health reform now. People over profit, health reform now. People over profit, health reform now.
You are one of us.
You know, it's amazing how the theme that Elfie just said very easily, we have to look in the mirror and see each other. We have to see the other person. And then to have the chant come up, we are your brothers and sisters. You are my brother and sister. Once we can be convinced of this, these two issues that we've dealt with 2 weeks in a row, immigration and healthcare reform, we'll start seeing the connection among all of us. This will take time, but we must start now. God bless.